Good morning, guys.
Morning.
Um, no, before we continue or start, any questions, guys? Any questions about anything?
No.
Nope. So far, you guys feel good? Good. Then let's just try to continue. So we're going to go on to chapter 21, which is mainly about artifacts. Clear? Okay. And well, okay. Ever since we started talking ultrasound physics, you might have heard me using this word here quite a few times. Okay. So what is that we can say that artifacts mainly as okay will be going to be as okay things such as inaccuracy of the image, or we can say scan. Okay. Now we can have different kind of inaccuracies, which could be things such as we can say it's okay that we see something on the scan which is not physically present. Clear? Okay. Okay. So sometimes SOK may appear on our scan or on our image, but SOK physically SOK there's no structure that actually SOK created that reflection or SOK. Clear? Now, if things can appear out of a certain on an image, then things can also disappear. So we can say it's okay that we do not see it's okay things on a scan which are physically present. Although it's okay, it may be there, it's okay, in the area that you scan. Okay, any structure. Okay. Oh, okay. But we may not be able to, yes, okay, see it on the image. Okay. Likewise, something like, okay, as incorrect shape. or size. Now, just you can say, okay, that will be inaccurate. That okay, they're saying that you were scanning something which was, let's say, it's okay, rectangular in shape. Okay, but it may appear as a circle, or it may appear round, or vice versa. Okay. Likewise, in size is physical, let's say it's okay, the size of a structure that you scan. For instance, okay, was 1 millimeter. Okay, but it may appear to be as okay a size of 5 millimeters. That is incorrect. Clear? Okay, that's going to be as okay, not accurate. Okay, so things as okay may appear in different shapes than they physically are, or likewise, okay, the shape may be it's okay, incorrect as well. Clear? Another kind would be things such as, okay, we can say, okay, incorrect position. Now, let's just say that, okay, yes, on a scan, when we scan an object, physically, it should appear here. This will happen, yes, okay, the correct position. But due to, yes, okay, whatsoever, okay, it may appear here. Okay. Now, in some cases, you may see both. You may see this one here, which is okay as the correct, and that's okay, yes. You may see, for instance, okay, a copy of this structure also appearing here, but this is physically, yes, okay, it was physically not present. Okay, so it could be, yes, okay, okay, sorry, an example of this too. Okay, but it can also be that, okay, yes, this structure, which is okay, in the area that you scan, yes, okay, was present here anatomically, but you don't see it here, but it actually is okay, has been moved over here. Or let's say here, whatever. Okay, so yes, okay, it may appear in the wrong position. Did you guys get that?
Yes.
Yeah.
Good, good. Likewise, guys. We can say, okay, incorrect brightness. Now, what was brightness? What do you mean by brightness? Mainly as, okay, just how bright? Or let's say it's okay, how dark an area or a structure may appear. Okay, or what we actually, as okay, we'll see is that, okay, as we will have these incorrect brightnesses, mainly as okay, related to neighboring structures. Okay, whereas mainly as okay, going to be as okay, that structure that comes in the path of the beam actually is okay, will cause that we will have a incorrect brightness related to the area, or that's okay, in the areas that's okay, related to that structure. Okay, but something yes, okay, may appear, you can say, okay, too bright. Or we can say, okay, incorrectly too bright. Clear? Okay, or some areas may yes, okay, appear incorrectly too dark. Okay, now when we say as okay, incorrectly too bright, mainly would mean that that area shouldn't have, as okay, wouldn't have appeared that bright on the scan. Clear? Okay. Okay. Had it not been for yes, okay, that structure that came in the path of the beam, okay, this area is okay would have appeared at a normal brightness. But there's something is okay, the structure that causes it to appear too bright. And likewise, too dark. Clear? Okay. Let's just do this and say it this way here. Let's say it's okay, there's a structure here. Okay. Now let's say it's okay, this area here is okay. Would not have been too bright, not too dark. Regular is okay, medium gray. But that maybe is okay. Okay. And we can say it's okay, and that would have been an absence of this structure here. But once it's okay, we have this structure here, it's okay, what may happen is that this area down here may be as okay too bright, or it can be too dark, which is pretty much going to be determined by the nature of the structure in the path of your beam. Okay, so you may as okay see as okay some reflection that appears very, very bright. Okay, which is wrong. Okay, so what is it that a bright reflection would, or what will you get if you see a bright reflection? What will be the thing that comes to your mind? This is produced by a tissue that produces a strong reflection, right? Clear. Okay, whereas if you see something which is too dark, you may say, well, okay, this is due to, yes, okay, this is produced by a tissue which was a weak reflector or a poor reflector, right? Okay, which may not always be the case. Clear. Did that make sense? Okay, okay. But some of these, yes, okay, artifacts, yes, okay, especially as okay, things like this one here. Because that's okay, that would do it, yes, okay, things such as poor axial resolution, for instance, and poor lateral resolution. Clear? Okay. In some instances, yes, okay, even this one here is okay, would be yes, okay, due to poor lateral resolution. Clear? Okay. That things actually is okay may appear in the wrong position. Okay, so when I was okay back then when we talked about SOK or resolutions, I mean SOK will say that a poor resolution mean SOK will primarily lead to artifacts. Okay, did that make sense? Okay, but the thing about artifacts is that okay, yes, okay, there will be things that just okay pop up on your scan, which physically ain't there. There may be things that you don't see which physically are there. Okay, you may see as okay things in incorrect shapes or sizes. It's probably going to be a little too extreme to say, okay, yes, a square is going to become a circle or a circle is going to become, yes, okay, that circle is going to become something like, okay, as star shape, and okay, as a star is going to become, yes, okay, diamond shape. But you guys get the thing, right? Okay, okay, clear. Okay, that thing just okay may not appear in there or show up in there. Correct shape. What will be the correct shape? Yes, okay, whatever shape that structure that you are scanning had, but yes, okay, may look like, or yes, it may represent in a different shape, which is incorrect. Clear? Okay, and likewise size. Small things, yes, okay, may appear bigger. Bigger things may appear smaller. Okay, they can be, yes, okay, in the wrong position. And yes, okay, we may see, yes, okay, incorrect brightnesses. Okay, but generally speaking, yes, okay, anything that is on the image that is not accurate can be linked to, yes, okay, can be referred to as an artifact. Okay, now guys, you may say, well, okay, this is a pain, because how would I know whether this is an artifact or not? Clear? Okay. Now, one thing about artifacts is that, okay, yes, and in some cases, okay, or what we can say about artifacts is that, okay, yes, they may, yes, okay, tend to disappear off your scan. Let's say that you see an artifact, okay, okay, but you're not sure, is this an artifact or is this real? Is this actual? Okay, what artifacts may tend to do is, as okay, since it's fake, okay, they may tend to, yes, okay, disappear off your scan if you change your scanning icon slightly. So you can make this as a slight maneuvering with the transducer. Okay, slight maneuvering of the transducer actually is okay, may cause the artifacts to disappear. Did that make sense? Okay. Now, with that said, guys, artifacts, okay, now they may be a pain, but what you will see as we okay go through as okay our artifacts is that some artifacts may actually as okay be of a diagnostic value. Okay, may be of a diagnostic value. Okay, so some of the artifacts may help you in a diagnosis because okay, a structure that you're scanning causes an artifact which tells you about the nature of that structure or area that caused the artifact. Okay, so it's not all bad about the artifacts. It's okay. The other side of the coin is that okay, there's also it's okay some good related to it, but at least then you should be able to say, well, okay, it is due to this and this and this and this structure that okay, as I see this and this and this thing here, which is an artifact. Okay, some artifact you just have to let be. Okay, there's really not much that you can do about them. They just appear. The only thing that you just will have to say, okay, well, what the hell? It's an artifact. Okay. Did I make myself clear? Okay. Now, some of you may say, what are the causes of an artifact? What are the causes of an artifact? Now, probably as okay, the main one that we will be talking about is going to be as okay, what they call violation of assumptions. Okay, so later on in the chapter, we're going to have, okay, as 6 assumptions. Okay, they're going to be as, okay, a total of 6 assumptions. And if one or more than these assumptions here are being violated, that will lead to an artifact. Is that clear? Okay. Next is, okay, yes, equipment malfunction, or yes, okay, poor design. Let's say yes, okay, that you are trying, yes, okay, that your system hasn't been, yes, okay, checked and so on, and it may start to, yes, okay, act weirdly, or it may need some, yes, okay, fine tuning and so on, okay. That can be, yes, okay, what you can call it, okay, equipment malfunction, etc. Physics of the ultrasound. Pretty much, okay, as some of the concepts that we have discussed, such as, yes, okay, lateral resolution, elevational resolution, temporal resolution, all those things. Okay, those poor resolutions as well also can lead to artifacts. Okay, intensity is going to be, as okay, a major thing that we will come across. Okay, so if you guys don't know about intensity, it would be a good idea to look that up. Clear? Okay, if you guys still are confused about focal point or focus, it would be a good thing to look that up. If you guys are not sure about things such as compensation, it will be a good idea to look that up. Clear? Okay. Okay. But generally speaking, you can say yes, okay, any poor resolution of any kind, yes, okay, will lead to artifacts. Is that clear? Okay. Even that's okay. What did we say about what hell was it in the previous chapter? Things such as your clutter or cluttering, ghosting. What were they? They were artifacts. Clear? Okay. It appeared as your blood vessel was bleeding. It wasn't, hopefully. Clear? But it just appeared so. Right? Okay. So that's an artifact. Okay. Aliasing, well, you can say it's okay. It's still considered an artifact because we get a false reading in the terms that, well, okay, we see negative Doppler shift, although it's okay. We had positives, or we see positives, although it's okay. Our actual Doppler shift reading was just negative. Okay, so that's the one that, okay, yes, should be fixed. Mainly so that we have somehow of a more accurate, yes, okay, velocity read. And yes, okay, do yes, okay, operator error. Now, guys, as far as artifacts or questions related to artifacts can be, some of you may ask, what kind of question should we expect? Clear? Okay. Now, since, yes, okay, artifacts are mainly things that you would see on a scan. Okay. An ideal type of question could be that you get a picture and they say, okay, what artifact is this? Clear? Okay. What artifact do you see on this image here? And then you just choose your answer. Clear? Okay. Now for that, yes, okay, you have to be able to, yes, okay, visually, let me put it this way, visually be able to identify the artifact, identify its characteristics, and based on that, on yes, okay, what you see, say, okay, this thing here is okay, has this feature, that fits into, yes, okay, the explanation of this artifact. So that's why I say, okay, this is a mirror image, or this is a focal enhancement, or whatsoever. Things like that, right? Okay. Did that make sense? So you get a picture and they ask, okay, what artifact do you see here? Another thing can be, and this is mainly as, okay, if you are not visual, or you could go as, okay, a visual learner. Well, okay, they may ask, okay, or you may ask, okay, give you a question and say, okay, you see something like this on your image. What kind of artifact do you think that is? So mainly as, okay, verbally explaining the features that an artifact will or may possess. And based on that, ask you, okay, yes, what would that be? Okay. So pretty much, okay, yes, how to, yes, okay, explain artifacts. Yes, okay, we have some common terms that we will be using. Is that clear? Okay. So what would they be? Now we can briefly, yes, okay, just say, okay, yes, the terms to, let's say, yes, okay, explain, or we can say, okay, define artifacts. That's just artifacts. They can pretty much, okay, explain or define anything. Well, okay, since we bring them up here, we're going to say, okay, that this is going to be used, yes, okay, define or explain the appearance of an artifact. How is it that an artifact is going to be looking like? No, we can mainly just, okay, just say, yes, okay, distribute that into two bigger or smaller groups or categories. One is going to be, yes, okay, the echosity. The other one we can say is, okay, it's going to be as, okay. It's a little bit different, difficulty as, okay, for a single word sheet. So we can say it's, okay, distribution, or let's say it's, okay, overall appearance of the artifact. Now, guys, when we say it's, okay, echosity, that's going to be, it's, okay, we can say the ability, let's put this straight. It's, okay, the brightness. Now, I use the word echosity. We can say it's, okay, because here it's echo. Okay. Echo was mainly as, okay, just another name for, yes, okay, for the reflection. Did you guys get that?
Yep.
Good. Okay. So now what we mainly can say is that, okay, yes, in this case, yes, okay, this is going to be as, okay, the reflection, which is mainly as, okay, going to, is, okay, describe the brightness. You can say, okay, the brightness of the artifact. Okay, the brightness of the artifact, but in most instances, that's, okay, related to the surrounding area, or we can say it's okay, tissues. So that would actually just okay explain the aquosity of your artifacts. Now here as okay, we mainly as okay, we can say there's going to be 4 categories of aquosities. Now one is going to be as okay what we call hyperechoic. Now what does hyper mean?
Above.
Above or greater than, right? Okay. Okay. And echoic here is mainly as okay, we can say as okay, reflection. Okay. So when okay as explaining this in terms of as okay in context to your artifact, you can mainly say that the artifact is having a greater brightness than the, let's say it's okay, surrounding tissues. What would I mean? That okay, yes, if this here is okay was your surrounding tissues, and there was something in the midst of all this which was going to just okay appear brighter than if okay yes that was okay as the artifact. You can mean say that your artifact is hyperechoic because it appears like a brighter reflection in the midst of okay as all the surrounding tissues. Did that make sense? Okay.
Yeah.
So you may see that okay, yes, this term is okay, hyperechoic, yes, okay, may be explained or maybe yes, okay, used when explaining yes, okay, the appearance of your artifact, which may mean that okay, yes, it will appear brighter than normal. Or it's going to as okay appear as brighter reflection in the midst of okay as otherwise relatively darker areas. Okay, the meaning is that okay, it's going to as okay be brighter than the surrounding tissues, which means it'll make it hyperechoic. Did you guys get that?
Yes.
Good. Now the other one is going to be as okay hypoechoic. Now guys, if you know what okay as the word hypo mean, is just below, right? Okay, or lesser than. Okay, the echoic is just going to be as okay the brightness. Or is okay due to the reflection. Or where we mean you can say that okay, yes, in this case is okay the artifact is going to be referred to as being hypoechoic if it has a brightness that is lesser than the surrounding tissue. Did that make sense? So we had surrounding tissue, and okay, yes, in the midst of all this, we see something that okay, yes, may appear less bright, or we can say less bright actually, so it could mean darker than, right? Did you guys get that?
Yeah.
Next to will be, oh, sorry, isoechoic. Okay, yes, okay, your echoic here means it's okay, just we can say it's okay pertaining to the reflection, which just is going to become brightness on your image, greater or lesser. But when we say sorry, not ICO, sorry. ISO mainly as okay means the things such as same or alike. Okay. That we mean you can say as okay, what would be isoechoic? That okay, yes, that the artifact, okay, has a yes similar brightness as yes, okay, the surrounding tissue. Okay. Last but not the least, and that's why it's okay, is going to be an echoic. Now, anechoic, yes, okay, it is one term. Okay, but okay, we can say okay, echoic here means okay, just pertaining to the reflection, which is going to just okay produce some sort of brightness. But it's okay here the word and just means no. Okay, so we can mainly say as okay, hypoechoic was mainly as okay if your artifact was less brighter than the surrounding tissue. Here you mainly say as okay, anechoic as okay, it has no brightness, or we can say it's okay, it's going to mean it's okay, be what you can call it's okay, pitch black. Not just less brighter than just okay, the surrounding tissue, but I mean it's okay, pitch black. Most likely it's okay, things such as empty cystic structures will be anechoic. Now, please mind my word. Empty. If you have something in it, that may produce as okay, some sort of brightness. Lesser or greater amount. Okay. Or we can mainly say as, okay, something that on a scan is going to look pitch black, just like my background back here that I'm pointing at. If you see something like this on your scan, that is anechoic. Or if you guys can see Lillian's shirt, that is anechoic. Okay, so something which is pitch black is anechoic. Okay, so that's okay. If you see an artifact that is pitch black or pitch dark, well, okay, yes, that will be, you can say, okay, this is an anechoic structure. Or it's okay, an anechoic. Any questions?
No.
Okay, guys. Now the other one was, okay, we can say the overall, yes, okay, distribution or appearance of an artifact. Now we can just look at it in this way, guys. Because that's going to be, yes, okay. Yes, okay, the overall appearance. Or we can say, okay, the overall, yes, okay, distribution of, let's say, it's okay, shades in the artifact or in a structure. Now that can be as, okay, of two types. We can have, okay, as what we call homogeneous. Now again, guy here, the word homo means same. And the word genius is not a stable genus, but mainly as, okay, we can just say it's okay. Or it should be as, okay, the distribution of things in a certain area also. Clear? Okay. Now what we may say is, okay, homogeneous. Let's say it's okay that this artifact here, or this structure here, was, okay, what may appear as an artifact had, okay, yes, or hyperechoic, for instance. Clear? Okay. And if those hyperechoic reflections, for instance, okay, was, we can say it's okay, the same throughout the artifact, or we can say it's okay, well, I mean it's okay, evenly distributed throughout. Then this structure here, okay, will be referred to as being homogeneous. Did you guys get that? Okay.
Yeah.
Or if we do it this way, guys. You guys like cookies?
Yes.
Good. It's good to like cookies. You say it's okay, chocolate chip cookie. Now, how would that chocolate chip cookie be homogeneous if you have an even distribution of the chocolate chips throughout the cookie? So it says, okay, If I take a bite of a standard size, let's say it's okay, 1 square inch, I will get at least 1 chocolate chip for each bite. That's how you can say, okay, that this cookie here was homogeneous because the chocolate chips were evenly distributed throughout that chocolate chip or a chocolate chip cookie. Did you guys get that? Okay. Did that make sense?
Yeah.
Good. Now, on the other hand, is what we call heterogeneous. Okay. Okay, they had the word, okay, the genius part is, it's not okay, it's still going to be that distribution, but we can mainly say, okay, the word hetero is going to be, it's okay, different. Okay, but I mean that, okay, yes, within, okay, yes, a structure, whatever it is, okay, some areas, yes, okay, you can say it's okay, maybe, we can say it's okay, hyperechoic, you can say it's okay, some areas maybe iso, even now, right now, yes, okay, it is a heterogeneous. Okay, but then you may even have areas within this, okay, the structure is okay, which also is okay, because okay, would have been okay, things such as an anechoic. Okay, did that make sense? So evenly as okay, or the same appearance within okay as a structure is going to be referred to as homogeneous. Where on the other hand, it's okay if it has an uneven appearance is going to be as okay heterogeneous. Did you guys get that? Or you can say it's okay, or chocolate chip cookies, that's okay in one area. A whole bunch of chocolate chips. Some areas, okay, just one of you here. And then that's okay. There may be areas where there is none. Did that make sense? Okay. So that's okay. Something which is, you can say, is evenly distributed will be homogeneous. Something which is not evenly distributed is heterogeneous. Okay. Echoes which are brighter than the surrounding tissue, or it's okay, we mainly will say it's okay that artifacts that are going to appear brighter than normal can be referred to as hyperechoic. Less brighter than the surrounding tissue, or less, or it's okay that the brightness actually is falsely low, will be hypoechoic. Isoechoic is okay if it appears same as okay the surrounding structures. probably not something that we'll come across. And then it's going to be okay, anechoic, which is just an extreme hypoechoic. Extreme hypoechoic is going to be anechoic. Did you guys get that?
Yep.
Okay. Any questions? Any questions, guys?
No.
Nah. Okay.
No.
Christian doesn't have a question, at least. Okay. Now, as we said earlier, okay, yes. We said that, okay, yes, violation of the assumption leads to artifact. Right? Violation of assumptions lead to artifacts. Now we mainly as okay have 6 assumptions. Now guys, one thing, nobody on the surface of this earth who is in his or her 5 normal senses or ask you what is the third assumption. Okay. Likewise, nobody in his or her sound mind should be asking you, yes, okay, where is the 5th assumption? Clear? Okay, so these are not standardized numbers. Did you guys get that? Clear? Okay. But yes, okay, there are 6 assumptions where, okay, as 1, or in some cases, as okay, more than 1 assumption may be violated. And due to that violation, that's why we get an artifact. Did you guys get that? Okay. Now the reason that okay that they have numbered them here as 1, 2, 3, 4, 5, 6, because okay for some of our artifacts, it would mainly say as okay this artifact here is due to the violation of assumption number 4. Okay, which mainly is okay. Then will just be okay as you look at that, you read okay assumption number 4, you go back and it's okay look at the list. What was that assumption number 4 said? And that will explain you as okay why this artifact here appeared, because this assumption here was violated. Did you guys get that?
Yep.
Good. Okay, so our first assumption is that sound travel in straight lines. Not always. Okay, not always. What will cause a sound wave not to travel in a straight line? This is traveling in a straight line. I can defect it off its course. As if I hit my camera, you guys be. Now this looks like, okay, I'm not going to say. That will reach a refraction. What was a refraction? What is a refraction? What is a refraction?
The bending of the sound wave when it's
Deviates off track, right?
Yeah.
Good. What cause refractions? What cause refractions? Students, I hate to say this, but I think you guys should try to just, okay, take some time out to look at chapter number 6.
It's different propagation speeds.
Okay. And
Oblique incidence.
oblique incidence. Guys, have any of you ever played pool? You guys, in the state, they call it pool. I don't know why. Pool is okay as something that you swim in. I don't think you should be swimming on that pool table unless you are afraid of deep water. But it's okay. In other places of the world, they call it billiard or snooker. Okay. What happens when you hit that ball straight ahead? That's okay, straight onto. It will go straight. Or your striker. But you hit it at, okay, as an oblique, as okay, at an angle which is the side is going to reflect like that. That's a reflection. Okay. That's refraction. Clear? Okay. So yes, okay. Things vary, yes, okay. May see things, that's okay. Artifacts due to refraction of the beam is because this violation here is going to be violated. Okay, so that refraction of the beam actually is okay, may cause the production of artifacts. As a matter of fact, guys, there is an artifact called the refraction. The artifacts are having names, right? Okay. Okay. You can't say, okay, well, this artifact is it's this. This has to got a name, right? Okay, you can't say this is a this. Okay, then if this is a this and this is a this, then what in the hell is the difference between this and this? Okay, so things have a name. Okay, if everything was called a this, then okay, your options on your question should have been option A, this, option B, this, option C, this, option D, this, and E, this. And whichever you chose, that's okay. You guys always say it's okay, but it is this. Okay, so there is an artifact called refraction. Did you guys get that? Now, what we'll call that artifact called refraction is due to refraction, which is a violation of this assumption here. Because sound waves, that's okay, can deviate off track, right? Did that make sense? Good. Sound wave travels directly, that's okay, through a reflector and back. Now, this is probably, yes, okay, one of the first assumptions that we're going to see being violated. Okay, so what was the assumption? That, okay, as a sound hits a boundary and comes directly back. Not necessarily. Okay, so when this assumption here is being violated, yes, okay, we will see. Yes, okay, our first assumption being violated and produce the first artifact that we will be talking about. Sound travels in soft tissues exactly at a speed of, okay, that's 1.5, or yes, okay, 1,540 meters per second. Not always. And that's inspired that we talk about soft tissues. Okay. So this is going to just, okay, give us what we can call it, okay, time error artifact. Clear? Okay. Okay. Pretty much, okay, as in one example, yes, okay, or one example of, okay, as where the shape, either the shape of a structure, as okay, maybe even as okay, the position of a structure may be incorrect. Did you guys get that? Clear? Okay. Reflections only offer as okay, only as okay arises from structures positioned in the beam's main axis. Nope. Do you guys remember lobes? Clear. Okay. Now, what was lobes? Energy is okay exiting, or yes, okay leaving the beam. So if the beam went like this and the lobe went like this, a structure over here will be misrepresented as it was in the beam's main axis. So lobes, whichever kind of lobes we had, could produce artifacts, right? Okay, so when we previously said that, okay, your lobes degrade just, okay, your lateral resolution. Yes, of course it will. Because if something which is physically as okay is over here, and I see it as here, then that's wrong. It's a wrong positioning, right? Okay. The imaging plane is very thin. Nope. And again, it's okay, what we're primarily seeing things such as lateral resolution and more in elevation resolution. Okay. The strength of the reflection, or you can say, okay, the aquosity or the brightness of a reflection is related to the characteristics of the tissue creating the reflection. Not always, because something might have been as okay a strong reflector, but it appears darker. Something might have been okay as a weaker reflector, but it appears brighter. Falsely bright or falsely dark. Okay, so it's not always going to be that you say, okay, this structure here appears bright. This has to be produced by a strong reflector. This structure here appears dark. It has to be produced by a weak reflector. Clear? Okay, you have to keep, yes, okay, the assumption or a violation of assumption in mind. That there is a possibility that, okay, yes, these 6 laws here or concepts here, yes, okay, may be violated. Did that make any sense at all.
Yep.
Good. Any questions, dear guys?
No.
No. Okay. What's your name, guys? Okay, now before we start talking about our artifacts, please, that's okay, read on these two first pages here, okay? Okay, guys? And when we come back, that's okay, we can start talking about our artifactables. Okay, guys, so see you guys in, should we see, at 10:30. Yes, guys. Welcome back. Any questions yet?
Not yet.
Not yet. Good. So let us just start with our first artifact. Reverberation. And okay, guys. Now what we actually is okay, we'll see what actually is going to appear here, which will be is okay, the real artifact reverberation is going, we can say, look at that, there will be an appearance of false reflections. And what we mean by false reflections is mainly going to be as okay that they appear on the scan. Okay. But the reason that they are going to be artifacts is that there is no structure or tissue that produced these reflections. Did you guys get that? Okay. So question number one, yes, okay. Price, that's okay. What may cause, yes, okay, this artifact here to appear. Okay. And let's say that, okay, yes, this is what's going to be as okay or image. Are going to be as okay the image that we will have. Let's just say that, okay, yes, just the one. Okay. This here, for instance, okay, that's going to be as okay the beam's main axis. But please keep in mind, guys, that okay, your beam goes like this. Back and forth, back and forth, back and forth. Okay. But let's just say it's okay in the course of the beam's main axis here is going to be two strong reflectors. Okay. Now mainly it's okay, you will have two strong reflectors. Now what will strong reflectors mean? That they as okay will produce bright reflections. Okay. As the sound, yes, okay, mainly yes, okay. Hits these reflectors here and reflects back, that will produce strong reflected or bright reflections. Okay. Did you guys get that?
Yeah.
Good. But the thing that happens here that actually is okay now ends up giving us these fake reflections. Is mainly that, let's say now normally as okay, we were said, okay, as sound travels, hit a reflector and comes back. Sound travel, hits a reflector and comes back. What mainly happens here is that the sound, instead of okay, as traveling and coming back, traveling and coming back, actually as okay ends up bouncing back and forth between these two strong reflectors here. Is that clear? Okay. And as a result of, okay, this bouncing back and forth, what's going to happen is, okay, the system may receive reflections, which primarily is, okay, are produced by these two reflectors here at greater and greater and greater and greater and greater and greater and greater time intervals. Okay, and what the system do is okay, is going to is okay perceive from that is that okay, we have similar reflections to these two here appearing at greater and greater and greater and greater and greater and greater and greater depths. Did you guys get that?
Yep.
There, okay, now if you just look at this image here, okay, sorry, that's going to make a mini version of it. Okay, well, very meaning can say is okay, the first two reflections that we get here. That's okay. What is that they are? These are the real reflections. Actually, it's okay, produced by physically present structures. What are going to be the nature of this structure? Yes, okay, that was going to be okay, a strong reflector. Did you guys get that? But what we mainly as okay, just see deeper to that are going to, yes, okay, all these here are going to be fake reflections. Okay, that we can mainly says, okay, there might not have been a structure here at these depths that would have produced these reflections here. Did you guys get that?
Yeah.
Good. Okay. Now, how would you know that, okay, yes, this is not, or this is an artifact or not an actual structure? Or it's okay that these actually is okay are fakes. Now, the thing is, now you just have to eyeball, okay? Nobody is going to ask you just, okay, physically, it's okay, go and take the measurement. But let's just assume, guys, that let's say it's okay, the distance between these two here, for instance, let's say, okay, was 2 millimeters, for instance. Did you guys get that? Okay, now these were the real reflectors, and mainly because these here, okay, they were fake reflections. There was no reflectors here that were okay, that would have produced these reflections here. They are mainly okay, just copies of these, but just appearing at okay as increasing and increasing and increasing depth, mainly because of, as we said earlier, that bouncing back and forth. Clear? Okay, but what you will see is that okay, yes, then the distance between this and this is also going to be yes, okay, 2 millimeters. You can even say yes, okay, between these two here is also going to be 2 millimeters. These two here is okay, also 2 millimeters. Did you guys get that? Okay, but as I say, yes, okay, you don't necessarily have to sit and okay, yes, take the measurements. It's mainly as okay, just a matter of eyeballing. They say, okay, well, okay, I see is okay, something similar to this, just appearing and deeper, 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 deeper. Okay, that's going to be as okay, what we call reverberation. Okay, another thing that we also will see. Okay, okay. Now, this one here is okay, is going to be, now these reflections here, even as okay at the deeper depths, although yes, okay, they are fakies, but mainly yes, okay, because they were copies of yes, okay, strong reflections which were had been appearing bright. Okay, these are also going to appear bright, and that mainly is okay, makes them hyperechoic. So what is that your reverberation is going to be? Is going to be as okay an artifact that represents hyperechoic. We can actually say, okay, say, and duplications of strong reflectors. Okay, the other thing is that, okay, yes, these strong reflectors here or strong reflections are going to be as okay, equidistant. What would that mean? Distant, just pertaining to distance. Equi, equal. Did you guys get that?
Yes.
Okay. And of course, that's okay. Let's say, okay, the structures that we had, there were the strong reflectors, or here. You may, as okay, will see the artifacts deeper to that and the beam's main axis. Okay. If your strong reflectors, for instance, okay, were here. You had a structure here which produces, okay, a strong reflection. Okay. Now the copies of these or the fakies of these would be here. Okay, because okay, when the sound beam, yes, okay, for instance, okay, travels like this, it's going to hit them here. So yes, okay, the copies of these two reflectors are going to, yes, okay, be produced here. Did you guys get that? So yes, okay, look in your book, figure 21.2. Okay, they may, yes, okay, show, yes, okay, your reverberation image like this. Okay, but what you mainly, yes, okay, will say that, okay, yes, the first two are real. Anything deeper to that, all these, yes, okay, are fakes. And what do we call this artifact here of these fake? Hyperechoic. Because I mean, yes, okay, just copies of these bright reflections here. Okay, but just appearing at yes, okay, at deeper and deeper and deeper distance, mainly because your system perceives, or mainly because, okay, the reflections coming back from this depth here is going to be greater than this. Okay, but mainly because of that bouncing back and forth, back and forth, back and forth, it mainly is okay, perceives that okay, the next reflection came back from a deeper depth, a deeper depth, and deeper depth, and deeper depth. Okay, but these mainly, yes, okay, are just the fake copies of these two reflectors.
Mike, so they'll always look like stripes almost, like it's not gonna be, like, would it be a shape ever or just like stripy?
Well, my idea, listen. Shit, sorry. Now, when you say shape, what do you mean? Like,
Like the
that's-
shape of an organ, like would it ever?
no, it's not really. It's not really going to be as okay an organ or so. Okay, you may as okay just have to think of okay as what can cause it. Now there are going to be as okay different examples of different types of what you want to call it reverberations. Okay, but let's just okay. So what I mainly said was okay yes. Well, okay, we said okay yes, this and this, right? Okay, something like this. Okay, yes, okay, two strong reflectors. Now, two strong reflectors may sound like okay, that mean two different organs, two different so and so. Now, it could mainly as okay just be as okay two layers within a membrane, for instance, which produced strong reflectors or strong reflections. Did that make sense? Okay, but if these, for instance, okay, were straight lines like this, then your fakies, because they're mainly as okay, just copies of these. Did you get that?
Yeah.
Okay, so let us just, okay, although it's probably not going to be realistic to have it, but let's just say that, okay, yes, our strong reflectors here were star-shaped. Did that make sense? Clear? Okay, so what are you going to expect then? That, okay, yes, something like this. Right, okay. Or more realistically, you can say, okay, well, okay, we have tissue, it's a strong, it's okay. They were strong reflectors, but they was okay running. Let's say it's okay, zigzag. Of course, that's okay, deeper down. What are you going to have then? Zigzags. Did that make sense?
Yep.
Right, okay. But we mainly, yes, okay, just can say that, okay, yes, in all this, these were the real ones, which mainly mean, okay, yes, that we only had these two tissues here, these two layers here, that actually is okay, produced their own reflections. Okay. What we have in this area here was something completely different. But maybe it's okay just because we got copies of these being produced here, here. That's why they will appear here. Okay? Did that make sense?
Yep.
But as I said, yes, okay. Now it's okay when you take a strong reflection, yes, okay, these here are going to be bright. And when we say it's okay, or strong, that's okay, it's going to be, it's okay, very bright, so that's okay. Hyperechoic. But so is your artifacts. Also, these here are going to be hyperechoic because they are mainly as okay. Practically as okay, they are produced by these, but they just appear at increasingly deeper depths. Clear? Okay. And what they're going to be is the distance between this is going to be equal to the distance between this. Did you guys get that? And as I said before the break, yes, okay. Assumption number 2. Assumption number 2 was the first one to be violated. Or let's say it's okay. Was going to be the first assumption that we will see getting violated when we talked about, or when we talk about our artifacts. Yes, Caitlin, did I answer your question?
Yeah, thank you.
Good. Okay. Just another thing to remember, guys, that, okay, yes, if your strong reflectors were here, okay, well, okay, you're not going to have the artifacts. The artifacts is not going to appear here. Or they are not going to appear here because, okay, that will not be in the beam's main axis. Of course, that's okay. We have the strong reflectors. If the strong reflectors, for instance, okay, were here, then that's okay. They were going to produce the artifacts like this. Or if the strong reflectors is okay over here, yes, okay, like this. Because this is then the beam's main axis, that's okay, it scans through this area here. Okay, but as we know, that's okay, the beam goes back and forth, back and forth, back and forth. Most likely, it's okay, automatically. Did you guys get that? Now, it may be that's okay, a little bit weird word to remember, right? Reverberation. Clear? Do you guys want to hear a silly story? Okay, maybe it helps. Maybe you go, okay, that was too much detail. But when, yes, okay. Sometimes, yes, okay, even the best can, yes, okay, tend to, yes, okay, misread a word the first time. So when I first read this, I said reverberation. Or what was it? Revertebration, revertebration. And I talked about vertebrae of a spine. But that actually helped me. Now this is where it's okay, the details may become a little bit yucky. Because do you guys know what Cave Mama and Cave Daddy used as a comb? Nope. No clue. The skeleton of a fish. Now, if you actually go and see, it's okay, what that's okay again, yes, okay, you guys call it artifacts, it's me, yes, okay, fossils. But anyways, of okay, yes, find from ancient times. Why would somebody store, yes, okay, the skeleton of a dead fish? That used to be their comb. But if you look at it, yes, okay, the distance between, yes, okay, the ribs is prime, yes, okay, will be, yes, okay, be the teeth of the comb that they will, yes, okay, brush through the hair are going to be equally distant. So doesn't that what it looks like here? So that's okay. Sometimes it's okay, misreading a word may help. Okay. And some of you will say that who in the blue world will use as okay the stinking skeleton of a dead fish as a comb. Now I don't know how many times that's okay. The caveman and women would take a shower. If they even believe in something like that. But that's yeah. Okay. So yes, okay, since they didn't have yes, okay, other means or tools back then, well, okay, you just have to use what you have handy, right? Clear? Okay, so any questions about this one here? No questions?
No.
Good. So please remember, guys, first two are reals. Anything deeper than that is fake. Yeah, okay. And No, that's okay. Tissue, that's okay. It may be seen as okay in cases of pleura. Pleura and even that's okay pericardium. Or that's okay, even that's okay in structures like okay the diaphragm. May it's okay produce this. So what is that you may see as okay things that's okay deeper and deeper and deeper in your image that may as okay look like okay as do we have multiple layers of pleura? Do we have multiple layers of diaphragm? And so on so. Did that make sense? Right, okay. Good. Now the next artifact is okay. The next artifact is going to be as okay known as a comet tail. Okay. Now please keep in mind, guys, that's okay. This artifact may also have okay as another name. And that official name is ring down artifact. Is that clear?
Yeah.
Good. Okay. Now, this may be, yes, okay, slightly similar to reverberation. But there's going to be, okay, a slight difference between, this and your, and the reverberation. But first of all, it's okay, we just look at the word comet tail. Now, does anybody know what a comet is?
A ball of gas.
Okay. A ball of gas. What kind of gas? Coming out this way or the other way?
Not that type of gas.
Okay, not that type of gas. Okay, what happens to that gas?
It like evaporates into the galaxy and the Earth.
Okay. How would you know that that just happened?
I don't know.
You don't know? Have you
No.
heard of what you call a shooting star? That's a comet. Okay. Now, what is the superstition of a shooting star?
Make a wish on it.
You make a wish on it, and do you think that comes true?
Absolutely not, but yes.
Absolutely not. Okay, then, okay, yes, you can just be sitting there and doing nothing but just at night time, yes, okay, look at the sky. Good. So, yes, okay. Right, okay. But, yes, okay, but we can say it's okay, comet. And what is that comet or a shooting star has? What does it have?
A tail.
Did you get that?
Yes.
Good. Now, guys, similarly here is okay, what causes this artifact here? Okay. Now this artifact here is okay, mainly yes, okay, we can say it's okay, is going to be yes, okay, due to a strong reflector. Okay, so similar to yes, okay, that of your reverberation. Although yes, okay, guys, the common reason why we see a comet star, sorry, comet star, comet tail, sorry, or ring down artifact as they may call it, is mainly yes, okay, due to the nature of this strong reflector here, which is mainly yes, okay, going to be yes, okay, metallic. So mainly yes, okay, any yes, okay, implanted material that is made of a metal. If you scan, yes, okay, if you scan an area where that metallic structure comes across the, you can say it's okay, sorry, beam will actually it's okay produce what we can call a comet tail artifact. Okay. Did you guys get that? Okay. Now, practically, guys, okay, sorry. It's this thing here. And likewise, okay, yes. This thing here is okay, which is called the comet tail. So, okay. And what remains is okay, C is okay in between it. Me is okay because here is okay, we have a strong reflector, most likely is okay, a metallic substance. We have okay something which is going to just okay look like usually we just call it okay a dirty shadow. Okay. But this comet tail here, all this one here is okay. What is that they're going to be? Yes, okay, they're going to be hyperechoic. But then here, what do we have? This is going to be hypoechoic, or in worst case scenario, can even yes, okay, be anechoic. Did you guys get that?
Yep.
Okay. Now you may say, okay, why is this 80 here? Okay, anechoic? Mainly because that metallic substance, which is okay, was a super strong reflector, mainly as okay, reflects back all of the energy. Okay, where when we it's okay, what just hits the side or the outer edges of okay, yes, this metallic substance here is okay. You have pung, pung, yes, okay, the sound wave traveling deeper without any hindrance. Okay. Now the question just comes as okay, why would somebody as okay get metal implanted into their body? Now most heart valves. Of course, yes, okay, we in this case, okay, say artificial heart valves. can be metallic. Now that metallic can be understood in two senses. Either just the ring into which is actual hardware is implanted, which would be biologic. But it's it is kept in a metallic ring. Or in extreme cases, that as you have a metallic ring, and within that metallic ring, yes, the valve itself is made up of three, or yes, just two flaps, which also are made out of metal. So practically, it's it's only going to be these here, which then cardiothoracic surgery will call a metallic heart valve. This one here is all this has an outer bar, it's metallic ring, but since that is the valve itself is whether it's two flaps or three flaps, by biologic we mainly is mean that it comes from something which was living. Even this one here is sense of the metallic, or sense of the metallic ring is going to be as a strong reflector. Did you guys get that? Yes, another thing that yes, people may get implanted, which would be things such as pacemakers. Did you guys get that?
Yeah.
Any questions? So what we mainly as can just say is here that as had it not been for this structure here is or this substance here is being as such a super strong reflector that it actually is squeezed, as the book says, the hyper accurate reflections to the sides. This could have been seen as a that you might have seen as copies and copies and copies and copies of reflections similar to that of your strong reflector at greater depths. But here's the metal is a super strong reflector. So that's that first reflection of, let's say it's the artificial heart valve, or let's say it's a pacemaker, is going to be as appearing super, 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 super bright. Did that make sense? And what you may see deeper to that is going to be less bright. So that means it's called that this one here is not only going to be as it's also going will become heterogeneous. Or just think of it this way, guys. These are people, and I ask them to run to reach this area here. Clear? Okay. Did that make sense? Now, what is it I may have placed in the way is this metal wall. Now, what do we see? You may say that, okay, this fellow here, 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 this fellow here. Okay. What are they going to do? They're going to run up against this wall. Hit this wall. Get a concussion, and I say, okay, to hell with it. We're going back. Whereas these remaining here, okay, pyum, 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 pyum. Yes, okay. Will be able to continue. Did that make sense?
Yeah.
Now, dear students, you can say, okay, these were the little bit of artifacts that we had to deal with. Okay, these were the bit of artifacts that we had to deal with. Okay, what did that mean? Now, what comes next is going to be easier to explain. Okay, guys. Any questions yet?
Not yet.
Not yet. Good. Now, guys, what can we say next? Now, guys, the main artifact here is going to be a shadow. Okay. Later today, we may talk about a sub-variety of a shadowing artifact, which is going to be what we call an edge shadow. Which means there's going to be a type of shadow artifact, but has a slight difference to it. Now, guys, when we say shadow, okay, what that means is why that means is it's easy to understand because this is how the artifact will appear. Did that make sense? So on your image, you may see a shadow. And how does a shadow look?
Dark.
Huh?
Dark.
Dark. Yeah, okay. So based on that, you can mainly say that a shadow is going to be either hypoechoic. or in extreme case, yes, okay, it may even be, yes, okay, and quick. Did you guys get that? Okay, but it's just going to look like as you had a shadow on your scan. Did you guys get that? No, you can say that's okay. Can't we have a shadow on a scan? Or can we have, okay, as a black or dark area on this on a scan? Yes, we can. But the thing here is that, okay, as this shadow here that we see, or this dark area, hypoanechoic area that we see here, is physically not, it may just, okay, not an actual presentation of the anatomy. This is an artifact. There's something that has caused this shadow here to appear. And had it not been for that something, we would not have had the shadow. This area here would not have been dark. Hypoanechoic. Is that clear? Okay, so there gotta be, yes, okay, something that produces this artifact here called the shadow. And what is that something? Okay, now we're not going to name the thing because it can be anything. But this something, yes, okay, has a certain common characteristic. And that is going to be highly attenuating. So there actually is going to be a structure which is highly attenuating. That comes in the path of your beams. That mainly causes that, okay, as deeper to that highly attenuating structure. Is there going to be a dark area? Which is going to be an artifact called or known as a shadow. Did you guys get that? Now we don't have to wait a year. We don't have to go far. Okay. So what do we, okay, what is that we can say? And okay, then we just relate it to, yes, okay, to, okay, you can say it's okay, a day-to-day example. Okay, so what was it that was going to be must? One thing that, okay, yes, we can say, okay, let's put it this way. Okay. Beams main axis. Okay. Now let's just say that, okay, yes, in the course of that beam's main axis, okay, we have the structure, which is highly attenuating. Yeah, okay. Now, guys, please, this is where, yes, okay, your list of attenuating structures is important. Clear, okay? Because any structure, any tissue, or any medium which has a low attenuation most likely is not going to produce a shadowing artifact. Clear? Okay. So it's mainly going to be medias, tissues, and so on, so on, so, which are highly attenuating. We mainly mean that they produce or they cause a lot of attenuation. That will lead to that you will see a artifact called shadow. Clear? Okay. But where is it that that artifact is going to appear? That shadow the shadow is always deeper to the highly attenuating structure. Did you guys get that? Now, please keep in mind, guys, lung is a highly attenuating structure. Okay? But lung does not produce strong reflections. It's not because it's a strong reflector that it is highly attenuating. It's more highly attenuating because of absorption and scattering. Clear? That's the main reason that causes the lung to be a highly attenuating structure. What about bones? Yes, guys. What about bones? Is bone a highly or low attenuating medium or tissue?
Hi.
Hi. Clear? Okay. But then what's going to be the difference between lung and bones? Now we say both of them are highly attenuating structures or mediums.
The propagation speed.
Okay, good. But are you going to be sitting there and, okay, your answer is correct, my dear. But are you going to be sitting there and measuring the speeds of the sound? No, right? Okay, you're not playing yes, okay, a traffic cop with the sound beams. That's okay. Okay. So on your image, what's going to be the difference between yes, okay, bone and lungs?
The density.
my dear, on the image. Of course, that's okay. Density, okay, good. Bone is more dense than lung, right? If you have lungs that are as dense as bone, you're having a breathing problem. Then. Or forget about a problem, you have no breathing. But on your image,
Is there going to be more reflection? Is there going to be more reflection on the? Oh, yeah.
what's going to have more reflection?
The lungs? No, the bone. The lungs are an open space, so
Okay, so if you scan side by side, lung and bone. Good. Which of these two here is going to be producing a stronger reflection?
bone.
Bones. And since they produce a stronger reflection, how is that going to appear on a scan?
Say it, Teresa.
Is it brighter?
It will be brighter. Here we go. That's not clear, right? Okay. Why? Because more energy has been reflected back, right? Clear? Okay. Okay. But in spite of that, yes, okay, you can say it's okay, the lung being a poor reflector, it still, yes, okay, has the highest attenuation. So please keep in mind here, yes, okay, it is not necessarily, yes, okay, a bright reflector or a strong reflector that necessarily, yes, okay, will produce shadowing. The thing is highly attenuating structure. Did you guys get that? And now, what do we mean by attenuation?
Like weakening of the signal?
Okay, weakening of the signals in terms of what? Yes, students, I'm becoming more and more difficult now. What weakens?
Power, intensity, and amplitude.
Okay, okay. So pretty much, okay, yes, anything, yes, okay, related to the amount of energy of the sound wave decreases. Okay, but you can mainly say, okay, so why is it that in this area, okay, sorry. Why is it that in this area is okay, we see something which is dark? Mainly because, okay, as that sound beam hits this highly attenuating structure, it can mainly cause, okay, that it might produce as, okay, strong reflections back, right? Okay, because, okay, not only was this a highly attenuating structure, but also a strong reflector, right? So like boom. Or as the sound travels through this medium here, it undergoes great degree of attenuation, which mainly will mean that, okay, by the time that it reaches down here, it has attenuated to such a low level that it was not going to be able to produce a meaningful reflection of the structures in this area here. And that's going to cause that, okay, yes, it appears dark. And that dark area or that dark shadow is what you call a shadow. Did you guys get that?
Yep.
Okay. But where are you going to see it? Well, okay, let's put it this way. We had a structure here. Or let's just take it a little bit down. That's fine. We can say it's okay that we had, okay, as a highly attenuating structure here, for instance. Most likely, yes, okay, the shadow will be seen here. Okay, you will not see the shadow here. You will not see the shadow here. Clear, okay, you will not see the shadow from this structure appearing over here. Mainly as, okay, deeper to the highly attenuating structure in the axis of the main beam. Now, guys, if you, for instance, had a highly attenuating structure here, well, okay, then the shadow would have been here. Well, this. Why? Because this is going to be as, okay, deeper to the beam's main axis when it hits this highly attenuating structure. So the shadow for this structure here is not going to be appearing here or here or here. Did you guys get that?
Yep.
Good. Now, on a daily basis, or something that you guys can go out and it's okay as experiment with when it gets dark. Usually it's okay when it gets dark, what happens? What happens when it gets dark?
It gets cold.
Okay. What if you are in the mid of month of July?
It still gets cold at night.
Ah, okay. But still,
There's no shadows.
there's no shadows or there are shadows.
I mean, if
What?
there are lights
Oh,
on,
it will probably be easier to see your shadow during the nighttime than daytime. Let's put it this way, guys. Because, okay, you're standing by a light pole. And what is that this light pole here does? It throws light, right? Did you guys get that?
Yes.
Good. Now, what is that you are going to be in the path of these light beams here? You're going to be as, okay, a highly attenuating structure. And that mainly causes that, okay, yes, what is it you will do? You will see your shadow here, right? Did that make sense?
Yeah.
Okay. So yes, okay, mainly if you look at, okay, yes, the axis of the light, yes, okay, you as a person or as any object, maybe as, okay, a highly attenuating structure, and that's why it's okay, you see your shadow here. Okay, now it's mainly as, okay, due to this shadow that tells, okay, yes, what you are made up of. Okay, something that is going to be able to just, okay, block the passage of light. Clear, okay. Now what's going to be as okay the disadvantage of a shadowing artifact? Okay, it may tell a lot about as okay you as a structure. But this advantage is that okay, God forbid that you have dropped your wallet. And that wallet had this many dollars. Would you be able to see your wallet?
No.
No. So exactly the same guy here. That okay, yes. We have this highly attenuating structure. Okay. Now what is it? Okay. What did that cause it? That okay, yes, not enough sound waves will be able to just okay reach just okay this deeper area of this highly attenuating structure. And okay, as whatever may be here, where there was any other is okay, any other structure that physically is okay or being here is okay, may not be visible on the scan. Did you guys get that? Okay, so whatever is okay structures may fall in the area is okay where a shadow is produced may not be visible. Did you guys get that? Did you guys get that?
Yeah.
Yes.
Good. Okay. So yes, okay, that may tell you about yes, okay. And it actually is okay, may also is okay, sorry, be of okay, yes, clinical or diagnostic importance. Okay. Because for instance, okay, we say that we have a cyst. Now what this cyst could be, yes, okay, it could be low attenuating. Okay, why may, yes, okay, because it may, yes, okay, contain, yes, okay, some thin fluid. But this cyst may also, yes, okay, have a higher attenuation. Although yes, okay, it still has fluid, but that's mainly going to be because okay, that fluid may be thicker. Super thick pus, for instance. Have you seen that? Well, okay, now she has a program on the TV, although I haven't watched that one. But I used to see her on, what's the name, YouTube, Dr. Pimple Popper. Yeah, okay, what a thing to discuss just before your lunch break, right? Okay. And you're not going to have second thoughts once you just, okay, put cheese on your bread. Let me just kill your appetite. Right, okay, but it's okay. What is that you get out of, okay, yes, those different, yes, okay, cysts and so on, so yes, okay, you can get, okay, yes, a thin fluid, or you can get a thick fluid, or something that may look like, okay, like cottage cheese. Cheese, right, okay. Did that make sense? Now she popped them. It's not going to be every cyst that can be popped. Some cysts may have to be aspirated. And what do you mean aspiration? With a needle and syringe sucked out, right? Now that fluid is thick and you use that thin needle, that's okay. It's going to be as okay a hell of a project to trying to pull that thick, cheesy substance out through a thin needle. Just try it. Okay, now don't do that experiment on your 4-leg pharaohs or anybody, but it's okay. I know from experience. Okay. Not to talk about, yes, okay, that cyst, although some people may say otherwise. But okay, if it is going to be thick, fluid, yes, okay. This thick fluid most likely, yes, okay, is going to, yes, okay, appear brighter within the cyst. Of course, that's okay. We can also say, okay, that this one here is okay, may more likely is okay, produce a shadow. Okay, here you most likely is okay, will not see a shadow. Because, okay, this was lowly attenuated. So that's okay, even though it's okay, the sound being positive, that's okay, it was still going to be, it's okay, strong enough to produce meaningful reflections, that's okay, from the deeper areas. Is that clear? Okay, now in your book, yes, okay, they talk about, yes, okay, gallstones. Or they have given you as an example of a gallstone. Okay, now just keep in mind, okay, gallstones, like any stone, is okay, is highly attenuated. Okay, even a bladder stone is going to be highly attenuated. A kidney stone is going to be highly attenuating, right? Why? If you talk of a kidney stone, what is the major ingredient in kidney stones? Or most of kidney stones?
Isn't it calcium?
Calcium. And where else do you have calcium?
In our bones.
In your bones. So here you go, right? Did you guys get that? Okay, guys, now let's just, okay, let's take a transfer section of somebody's abdomen. Let's say it's okay, this is the transfer section of the abdomen. Just as okay, display as okay, let's say it's okay where the anatomy is. So we can say, okay, let's just say that this is the right side. Let's say it's okay, that this is the left side of the abdomen. Did that make sense? Now, what we mainly can say is, okay, as what we have here. Is the liver. Did you guys get that?
Yep.
Good. Okay. And practically, yes, okay. Somewhere here, it's okay. That's where we have the gallbladder. So this fellow here is okay, is our gallbladder. But let's just say that, okay, this gallbladder here is okay. What is it that it will have? It has stones. Did you guys get that?
Yep.
Yes.
Good. Now, guys, one thing. If you, for instance, okay, have your scanner placed here. Let's say it's okay, A. We can mainly say it's okay, that as a result of A, that's going to be as okay, where you will have the shadow. Why? Because it's okay, deeper to the beam's main axis. Or deeper to the highly attenuating structure in the beam's main axis. Did you guys get that?
Yeah.
Good. What we can say is, okay, if you then shift your angle from where you're scanning to, let's say it's okay, like this. We can say, it's okay, this is view B, for instance. Now this is going to be, it's okay, where you will have your shadow. Why? Because this is your beam's main axis, right? Yeah. So now it's okay. From this view here, it's okay. This area here is going to be at a greater depth on your image. Then you may say, okay, well, okay, yes. Or A is okay, it's going to appear like this. Okay, it's okay, it's okay, it's okay, your liver. You can say, it's okay, you may have your, okay, yes, gallbladder, and okay, yes, where you will have, okay, yes, the stones, but it's okay, it's going to be here. Then you will see the shadow. Even as okay, you go for as okay, view B, for instance. Let's just assume that, okay, as you dodge the liver. Although not probably possible, but you can say, okay, this becomes your gallbladder. And of course, it's okay with the stones. And then it's just going to be, it's okay, deeper to that. Okay. So how can we define a shadow? as appearance and as what causes it. Verbally, a hypo or anechoic shadow deeper to a highly attenuating structure along the beam's main axis. Did that make sense? Okay. Or similarly, well, okay, yes. If we didn't have this light pole here, but rather, yes, okay, a light pole here. Then your shadow would have been over here, right? Did that make sense? Because no, you were the highly attenuating structure in the beam's main axis. So deeper to that is going to be as okay where you have the shadow. And yes, okay, now you'll be able to see, yes, okay, your long lost wallet with the $1,000 billion in it. And since I showed you how to locate your long lost wallet, I'm not going to ask for much, just 20%. Now you can just wish and say, yes, okay, damn it. I just kept lesser money in my wallet that got lost. No, just kidding, guys. I'm not going to asking for any percent. The best percent you guys can get me is a good percentage on your chests. That's all. Okay. That's the percentage that I'm looking forward. Okay, guys. Any questions about shadowing? Okay, so as far as appearance is concerned, hypo or anechoic. Okay, where deeper to, okay, there has to be something that produces that shadow, highly attenuating structure. Please, guys, not necessarily strong reflector. Highly attenuating structure. Okay, that's why it's okay. That's where, okay, things such as, okay, your lung comes into the picture. Did you guys get that?
Yep.
Any questions? Any questions, guys?
No.
Okay, now I don't know how much I destroyed your appetite for cheeses and butters and ricotta cheese and yogurt and whatever's. Shakes. But take your lunch break and please make sure that you know when you come back that you know what causes a refraction. And that you know a bit about your beam and focus. Okay. So where do you know about, where do you study about refraction? Chapter 6. Where do you talk about beam and focus? Chapter 9-ish. Focal point and things like that, right? Okay. And please make sure that you also, as okay, know the relationship between intensity and area. Okay, guys. So would it be fair enough to say that I see you guys back at around 1? Okay, guys. Have fun till then. And before I continue, anything that you want to ask about? Nope. Okay, guys. So the next topic that we will talk about is going to be edge shadow. Now, what is the shadow going to be? Here, its main is okay, it is going to be a shadow, which is going to be a hypo or anechoic. No, probably it's okay. Not anechoic. It's going to be hypoechoic, sorry. Okay. Hypoechoic. Area. Okay. The remaining says, okay, all this, okay, here the edge. Now this mean is okay. Reason we call it edge is because it's caused by the edge of this of a curved surface of a structure. That is going to lead to a shadow, edge shadow. Okay, guys. And one thing that we will look at is that okay, this is a curved edge of the structure is going to lead to a refraction. Did you guys get that? Okay. And what is that we're going to see in this refracted area? Is going to be a certain edge shadow. Now look here, guys. We can say it's okay that we have a structure. Let's say it's okay. We have a structure. Okay. Now what this structure here is going to have is it may have as okay. It's going to have these curved edges. Did you guys get that?
Yep.
We can mainly say, okay, now the beam that hits here. Okay. Now we can also say, okay, this structure here is okay, maybe. Now, what's going to happen to the beam that hits here? And let's say it's okay, the beams that hits here. Let's put it this way. I do it this way. This one here. And this one here. Okay, and mainly because okay, this curved edges here is okay, that's going to mainly lead to that okay, yes, it's the boundary or the surface or the tissue at an oblique angle. Okay. And what we actually is okay will have as a result of that is we can say it's okay that these beams here, they may refract. Okay. Now, what we can say is okay, yes, we may have had okay, let's say it's okay, a regular shadow here. Okay. Or no shadow. But actually it's okay, but the edge shadow is going to be this. Is going to be the edge shadow. Okay, now the reason that we call it a shadow, I mean, is because it's going to appear hypoechoic. Okay. It means it's okay going to be it's okay darker than let's say it's okay this area here and this area here. Okay. So we will have it being hypoechoic. Mainly because okay becomes hypoechoic, that's why we call it a shadow. What caused it was mainly as okay the edge or the curved edge of a structure. Okay, where that curve at the edge mainly caused that okay, yes, the beam is going to yes, okay, hit it at an oblique angle, which causes refraction. Did you guys get that?
Yep.
Good. Any questions?
Nope.
Good. Now, guys, if you now look at this hypoechoic, oh sorry, edge shadow area here. If you say about this or this. Okay. Or if you just look at it like this. Because that's okay. This, and then we had okay as the edge sharing, which was going to be this area. Now, besides being yes, okay, hypoechoic, it's also going to still be as okay what we refer to as being heterogeneous. And why is that? Mainly because it's going to, it's okay, because it's okay as we go deeper and deeper into the edge shadow, it's going to become darker and darker. So although yes, okay, so here it okay as at the shallow depths, it's still going to be a shadow, but it's going to be as okay relatively a brighter shadow. But it will actually is okay deeper down, it may get dark. And we can say, okay, even further deeper down, it gets more dark. And then, okay, yes, very, very deep is going to be as okay, very, very dark, or the darkest. Did you guys get that? And this is mainly because, as we see that, okay, as the area of your edge shadow, as we go deeper and deeper and deeper, as we go deeper, the area of the edge shadow increases. Okay. So due to just okay, the greater area here versus greater lesser area up here, we know that intensity is inversely proportional to area. Where okay, up here, we may still have okay, yes, a greater intensity compared to down here is okay, where the intensity is at its lowest. Okay, but this is not due to yes, okay, attenuation, is rather because that the area in which yes, okay, the energy of this wave here is distributed is greater compared to up here. So what you actually see is okay, that your edge shadow gets progressively more and more and more and more dark. Okay, did that make sense? And since that's okay, that's distribution of the darkness or of the shadow is not the same throughout, but actually it's okay, varies from depth to depth to depth to depth. That's why we can say that it's also going to be heterogeneous. Did you guys get that?
Yep.
Okay, guys. Any questions?
Not yet.
Not yet. So what is edge shadow? Well, okay, still going to be shadow darker. Okay, appear as a darker area. Okay, but what mainly caused it here was mainly okay due to the refraction as a sound beam is okay hits the curved edge of a structure. Okay, and when it hits a curved edge of a structure, it's going to yes okay refract. And what do you mean by refraction? That it actually is okay will that it actually is okay will deviate off its track. Okay, and due to that, just okay deviation, the area of the is okay is going to become greater and greater and greater at greater and greater depths, which mainly cause that okay yes the intensity within this area here or here is going to just okay decrease as we go deeper and deeper and deeper. I may call it, okay, gradually, it's okay, increases in its darkness. And since it is not evenly, yes, okay, that's why we can say it's okay, it will still be, it's going to be, it's okay, heterogeneously hypoechoic. Any questions? Or any questions about shadowing in general? Nope. Pretty clear. Pretty cut. Okay, guys. C. Now, guys, let's just talk about, yes, okay, our last artifact for today. Okay, guys. Is mainly going to be enhancement. Now, a subtype of enhancement, just as we had in shadowing, that we may talk about later today, is going to be as okay, focal enhancement. Now, before going into yes, okay, we can say it's okay, the details of enhancement and so on, so on. So, is there anybody who know what it means to enhance?
Like to make clearer.
Okay. So when you filter muddy water and it comes out clear, is that enhancement?
No.
Ah, okay. Sorry, dear. Anybody else?
To like improve something.
Okay. Improve it in what sense? Please don't say make it clearer. Okay, guys, let's say you are not happy with your scores. And you come and you ask, can I get my grades enhanced? What would that mean then?
Improved.
Not improved, because what you guys may think as an improvement, I said, well, okay, yes, we can improve it, but that requires enhancement, guys. Oh God. It's just another word for increasing. You say improved, yes, okay, I say, well, you got 93%, what else do you want? So enhancement, actually, that's okay, or enhancement means, okay, to increase. Okay. Now, guys, do you want to cheat? Do you guys want to cheat
Yes.
to remember enhancement?
Yes.
Good. Do you know your shadow artifact? Okay, how much can anybody tell me about a shadowing artifact right now? Without looking at your books or notes. Okay, guys, why do we call it a shadow?
Because it's dark.
It's dark. Okay, good. Okay, okay. Technically, what would be the term that we use for something which is dark?
Anechoic.
Okay, or
Hypochoic. Hypoic.
hypoechoic. Exactly. Good. Okay, good. Where did we see it? Where did we see the shadow?
With mediums that have high attenuation.
Medium?
With mediums that have high attenuation.
No, it was a medium that had high attenuation that caused shadowing. My question was, where?
Like directly parallel to the beam's main axis.
Okay. But where would the shadow appear?
Like directly below the
Deeper,
deeper. Yeah.
deeper to your highly attenuating structure. Clear? Okay. Okay. Did that make sense? Okay. Now, maybe it's okay, just the 2 out of the 3 factors of shadowing has to be flipped upside down to explain enhancement. Okay. So if we just do it this way, guys. So whichever you want to remember, but just keep that okay as enhancement, mainly as okay, just going to mean okay, increased. What is going to increase here? Yes, okay, what you'll see is the brightness of, okay, we can say it's okay, an area of the scan. Okay, but let's just do it this way, guys. That's fine. We can say enhancement versus shadow. Okay. Now, one thing that we could say about shadow was that it was hypoechoic or in extreme cases, anechoic, right? Clear? Okay. What caused the shadowing? It was mainly okay due to highly attenuating structure. Did that make sense? Right? Okay. And we can say, okay, where does it appear? Now we can say, okay, that will be deeper to the highly attenuating structure. Okay, because that's okay, but still it's okay along the beam's main axis. Did you guys get that?
Yes.
Now, my dear guys, enhancement. Now, what is that your enhancement is going to be? It's going to be the complete opposite of a shadowing, which was okay, hyperechoic or anechoic, which mainly is okay, made it dark. This fellow here is going to be hyperechoic. And what does that mean to be hyperechoic? It is going to be bright. Did you guys get that?
Yes.
Okay, so your enhancement, what are they going to be? They're not going to be dark. It is going to be as okay, very bright reflections that you will see on your image. Now the next thing comes as okay, yes, what causes this enhancement, which is an artifact. And unlike your shadow, which was due to yes, okay, a highly attenuating structure, this one here is going to be due to a low attenuating structure. Did you guys get that?
Yes.
So what is that you can say? The opposite of enhancement is shadowing, or the opposite of shadowing is enhancement when it comes to these 2 points here. The only point that they is okay, you can say, okay, have in common is the wear factor. Because okay, where is that this these hyperechoic reflections are going to appear, is going to be as okay deeper to this low attenuating structure. So wherever do you have your enhancement, it's going to be deeper to the low attenuating structure. Okay? Did you guys get that?
Yep.
Okay. Any questions? So let us just look at it, guys. Let's say that, okay, yes, we have our scan. Okay. We can say, okay, our beams main axis, so like this. Yeah, okay. What we had here was, oopsie, no, this structure here, whatever. And what of this is going to be as okay, your low attenuating structure. Now, what does it mean to as okay be having a low attenuation? that, okay, as the sound wave, yes, okay, passes through the structure, is not going to undergo much attenuation, right? Clear? Okay, so you can say, okay, the strength of the beam that passes on the other side and mainly as, okay, hit the structures that we have here, it's still going to be strong, right? Did you guys get that?
Yes.
Okay. Okay. But what that is now going to cause is that these structures here, or these reflectors here, are going to produce, and you can say, it's okay, let's do it this way, abnormally bright reflections, which was mainly as, okay, due to having this low attenuating structure in the pathway of the beam. Clear? Okay. Okay. Now, please keep in mind, guys, unlike your reverberation, these are not fake reflectors. These are not reflectors that are appearing on the scan out of nowhere as, okay, as copies of something that we had anywhere, for instance, here. These are actually as, okay, actual reflectors, but they just appear abnormally bright. So them appearing as, okay, abnormally as, okay, bright, or that their brightness is increased, is what you will call enhancement. Did you guys get that? Well, let me put it this way. It may feel nice these days where the weather is still, okay? And now right now, yes, okay, where most of you are sitting far away from a window. Well, not directly in front of a window, right? Okay. But what do you feel when you sit right next to the window? Especially now, I can talk of Connecticut, Fairfield County.
Warmth from the sun.
Warm from the sun. Actually warmer than you would have felt even if you went outside. Did that make sense? So you can mainly say, okay, what is it that the glass of your window might have done? Enhance the temperature of the sunlight, right? Did that make sense? So in this case, yes, okay, what is it that your window is? A low attenuating structure. Did that make sense? Contra to your wall. Okay. Did that make any sense? Okay, but please, 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 please keep in mind here, these reflectors here are not fake. They are reflectors which are physically present. The only thing that is, you can say, well, okay, wrong about them is that they appear abnormally bright. Okay, we can say as, okay, let's just say, okay, the same image here. Okay, the only difference was, okay, so the only difference, sorry, would have been that let's just say that, okay, yes, we didn't have this low attenuating structure. Then, okay, yes, you will still have had these reflections here, but strangely enough, that's okay, they would have appeared darker than what you see. Did you guys get that?
Yeah.
Okay. But comparing and contrasting, yes, okay, shadowing or shadow to enhancement is just going to be as okay, two opposites. The only thing that they have in common is okay, as you can see, it says okay, the point of okay, a location of your of an artifact appears. Deeper to yes, okay, to the structure, which in shadowing is going to be as okay, highly attenuating, whereas in enhancement is going to be low attenuating. Okay, and as we said earlier, well, okay, yes, what would be yes, okay, a common example of okay, yes, of a low attenuating structure? We can say it's okay, cysts with clear or thin fluid. Now, normally speaking, guys, what would be a cyst with a clear fluid? Not like, okay, crystal clear, but clear fluid. What would be an example of a cyst with a clear fluid?
That'd be like a sebaceous cyst.
Yeah, okay. But Kristen, I don't think that is okay. Good answer. But that can easily become infected. And okay, what you actually get out of it is then going to be as okay, thick pus. Secondly, now it may sound disappointing, but it's okay. You probably as okay won't be scanning sebaceous cyst, but good thinking.
Ovarian cyst.
Ovarian cyst can be yes, okay, exactly. Can be clear cysts. Okay, but again, yes, okay, my dear, even they can get infected. Or as okay, you can say the fluid in it can turn into pus.
Is a mucus cyst clear?
While okay, clear, not clear, it's more like okay, the consistency, or let's say it's okay, the viscosity of the fluid. Okay. But guys, you don't have to be sick having yes, okay, either pimples or sebaceous cysts or ovarian cysts. So what could be a cyst that all of us have? All of us, and that includes me and Kristen, which will have a clear fluid on a scan.
Is it a bladder?
Bladder. I hope not that, okay, yes, when you want to go and pee pee, that something like whipped cream comes out. Coca-Cola or something. Right, okay. It's going to either yes, okay, be relatively yes, okay, clear. Even if it's okay, yes, yellowish in color, but that's not going to yes, okay, affect, you can say, it's okay, the consistency or the viscosity of the urine. So what is that you may see as okay right next to a urinary bladder? What do you see right next to a urinary bladder? Yes, guys, don't worry about that one. Okay, urinary bladder, low attenuating structure. What do you see next to a urinary bladder then? Or deeper in the view? Or deeper to your urinary bladder? Deeper to your urinary bladder?
Is it your kidney?
No. OMG.
Gallbladder?
Huh?
Gallbladder?
What do you say there? What do you see deeper to your urinary bladder? In your image. Yes, Caitlin, what did you just say? Which bladder?
Gallbladder. I thought you were looking for another bladder.
No, right? OMG. My question is, I think I already gave you yes, okay, all the hints. And you guys are going to be banging your heads against the wall once I give you the answer. Your urinary bladder, what would that mainly hold? Urine, right? Okay. Now, as a fluid, what is the consistency of urine?
Thin.
Thin. Good. What does that make urine? A low attenuating medium, right? Good. Now, what do you see right next to a urinary bladder? Or deeper to a urinary bladder on your scanning?
You have smooth muscles surrounding it, right?
Okay.
Your ureters?
Oh my God. You guys are bringing bladder, gallbladders, kidneys. Listen, guys. This is your scan. Here is your urinary bladder. And we already said, okay, urine is pretty then of a fluid, right?
Right.
Good. And my question was, what do you see deeper to the urinary bladder on your image?
Descending colon.
I'm not talking of a structure, girls. I already, listen, my dear. I even gave you the answer is right in front of your eyes. What do you call this?
Is
Are you
it
talking about a
is it
shadow?
a fluid?
Why would it be a shadow? OMG, you guys. Enhancement. Please keep in mind, guys, that's okay. Usually it's okay if you physically will be scanning a bladder. Let's just say that, okay, yes, this is a view of, okay, yes, a person's abdomen. Okay. Here is, okay, you have your symphysis pubis. The bladder normally is okay would be an area like here. So most likely it's okay. You may as okay have to place your transducer some way like this, but okay, this is going to be because it's okay your beam's main axis. Okay, so yes, okay, whatever structure that might have been, yes, sorry, down here or deeper, you may see yes, some brighter reflections from that, which is enhancement. I don't know where you guys brought the kidneys down. Why did you guys bring the gallbladder? Um, exact, colon and all that. That's fine. Yes, okay. Now, instead of laughing your gut out, I don't go and bang my head against the wall because, okay, can you see that?
Mike, you should be so proud that we know all the structures down there.
Well, okay, yeah, for some of you, I'll be proud. I may not know about the gallbladder. Yes, dear. Do you guys remember Jack or Bob? Yes, okay. I don't think his gallbladder is going to be down there. In the pelvis. That's fine. Right, okay. But the concept, the general thing is that, okay, yes, when you scan areas, because guys, this is what you're going to, yes, okay, be starting doing sooner or later. Clear, okay? Okay. So the thing that you need to is, okay, think about it is, first of all, is, okay, what is the structure that I'm scanning? What's the nature of it? Okay. Okay. Most likely as okay as far as okay as scanning on okay as amongst you guys, yes, okay, hopefully, yes, okay, you will see, yes, okay, what normal things look like. Abnormal findings, abnormal pictures of, okay, yes, what would this look like or that look like, so on, so on, so. That's why, okay, yes, I guess, okay, your staff will be using picture slides and so on, so. Again, yes, okay, it's all about the concept. Again, yes, okay, you still be, okay, a clear, yes, okay, low attenuating structure. Okay, why is it why is it going to be as okay a low attenuating structure? Because physically, yes, okay, it's hollow. A hollow space is always going to be low attenuating. Clear? Okay. Now that can change. Because yes, okay, you can say it's okay, a stone in that bladder. If you had a bladder stone, what is it that you will see as okay directly in the area of that? Let's say that okay, yes, we had a bladder stone here. Or let's say it's okay that there was a bladder stone here. Okay. You may see as okay some shadow, or yeah, you yes okay, maybe you yes okay shadow within the bladder due to the stone. Okay, but what is the stone going to look like? Well, okay, usually it's okay, a stone is going to appear right. Why? Because it's a strong reflector. Okay. It may be in some instances, okay, a little bit different story when you talk of gallstones. Okay. Okay, guys.
Are you all done with us today, Mike?
That was an intense sigh.
Okay, that's fine. Now, off the record, my daughter once asked somebody if he knew what the thyroid was. And what that guy told him, or told her, sorry, that the thyroid was the bone in the thigh. Maybe he just tried to act it, act stupid or funny or whatever you want to do. Okay, but like, okay. And she go, are you serious? Okay. So yes, okay, the bone in the thigh is not called the thyroid, right? Yes, what do we call that? What do we call the bone in the thigh? No, Caitlin, you didn't say anything. Okay, go ahead. Yeah. Let's see.
The femur.
Not femur. Okay, good. Thank you. Okay. Okay, guys. So, okay, see you guys on Monday. And okay, I thought we were going to be able to just okay focus on focal enhancement, but I guess it's okay. We got off because we had to focus on gallbladders right next to the right next to our urinary bladder, things like that. Okay, please don't get offended, right? Okay, it doesn't happen. It doesn't hurt to joke. Okay, okay. So yes, okay. You guys have something to laugh at during the weekend. Okay. Any questions, guys, before I adjourn the class? Nope. Everybody good? Okay, guys. Then okay, and one thing I would like you guys to do for okay, that's okay. Still just look at your focusing. If you haven't got the chance to do so, look at your lobes. Clear, okay. Please make sure that you are on top of your resolutions as axial resolution and lateral resolution. And what else? And yes, okay. That you look yourself in the mirror. Yeah, okay. That will become, yes, okay, handy on Monday. And you know the requirements for a refraction with an RE. Okay. See you guys on Monday.
Have
Have a
a
good
good
weekend.
weekend.
Have fun, my
Bye.
dear ones. Okay, bye-bye.